Hello, my name is Ludger Grote. I'm a pulmonary physician at the Sleep Disorders Clinic in the Sahlgrenska University Hospital in Gothenburg in Sweden. My personal interest is the diagnosis and treatment of patients with the variety of sleep disorders, but specifically sleep disorder breathing and cardiovascular dysfunction during sleep. Sleep deprivation is, of course, a major problem because it really affects our brain functions, and by that also our capability to perform our work most efficiently and without any major mistakes. So systematic sleep deficiency or sleep deprivation, of course, increases the risk for car accidents or for accidents at the work, which also, of course, impairs productivity at all. So it's very well known that sleep deprivation per se increases the risk of accidents, which in some cases really can cause a major loss of productivity in certain factories, or even doing damage to people, and in accidents that can hurt. So it's a major impact, of course. Yes, we have done specific studies on the impact of sleep disorders and sleep disorder breathing on public transporters, drivers, or other drivers. And what we really can see, and we performed studies, and one of my PhD students specifically looked on that. We did a study in more than 100 bus and tram drivers in the city of Gothenburg, and we found out that 35 of them had sleep disorder breathing with more than 15 pauses per hour of sleep, which we call significant sleep apnea. On those, we decided to treat 20 of them, and we actually managed to have a successful treatment in 15 out of them. We could document that the amount of alertness is much higher. And prior to our diagnostic procedure, they actually had 4 times higher accident rates compared to the other drivers who did not have a sleep apnea complaint. So altogether, it's a very clear indication that sleep apnea is a major problem for drivers and professional drivers, and particularly, of course, public transport drivers, because they often have a very, very tough scheme which disturbs the circadian rhythm. So I think a systematic assessment of sleep and sleep problem in those drivers is a good idea in order to prevent major damage and accidents and loss of life. It is well known that obesity is one of the main predisposing factors for obstructive sleep apnea. In individuals with a BMI above 30, we know that you must expect at least 50% suffering from sleep apnea. In particular, in severe obesity, the sleep apnea can turn out to be really life-threatening by inducing a lot of hypoxia, the so-called obesity hypoventilation syndrome, which has a very bad prognosis. So, of course, in countries with a high degree of obesity, the prevalence of sleep apnea is expected to be quite higher. Yeah, it's a really complex question. You know, that people really see sleep as a friend. It's a very important 1/3 of life. Needs, of course, a lot of information. So sleep usually for each individual it's a little bit like a black box. You don't know what's going on, and you only know if sleep is too short, or if you lack sleep. You have a certain amount of problems. You're not alert, you probably get a little bit easy angry, or you probably have a little bit of loss of memory. So if you want to put this information, what is the role of sleep in life, to the general public, I think you really need some kind of awareness campaigns, and then you have to implement it in medical system as well. So I think you need to do really good studies. You need epidemiological studies where you ask people on the street how often they sleep, how sleepy they are, if they have accidents, if they are angry or not, to show the relevance for your people in your country. How does sleep affect quality of life, you know, subjective sleep quality, sleep length, so that you can probably show that those people who have very short sleep, or who feel unrefreshed sleep, or who are very sleepy during the day, that they have a reduced quality of life. And at the same time, you have to show in your country that the modification of sleep behavior, so you increase the sleep lengths or you improve sleep quality, that this really improves people's quality of life, and on the long-term run, of course, reduces risk of accidents, reduces risk of psychiatric disorders, for instance. So it's a complex task to be performed step by step. And at least in Sweden, you know, our people in Sweden, they want to have studies performed in our country. There's a lot of knowledge from the US or from Europe, but you know, everyone wants to know it from their own country. So therefore, of course, I think it's very important that you start to do very good studies, which you can then transport the information about the importance of sleep to the people of Malaysia, of course.